And I love it when we're having conversations with patients as opposed to just sending them a letter. When you send a letter, you don't get the benefit of a two-way conversation. It's a one-way street.
Yes.
You send the letter and they read it.
Yeah. Letter is not really it's not a conversation, like you said. It's a one-way communication, and a lot of times 90% of the message never gets delivered because either they don't read it, or even they do, they don't understand what you're trying to say.
There's a study, a well-known study in linguistics that says that only 7% of a message is made up of the words. 7% of the message. So when you send the letter, the other 93%, by the way, what is the other 93% of a message? If it's not the words, what's the other 93%?
The other 93% is the facial expressions, is the person listening, are they
well,
cringing?
It might be some other parts.
All those
it could be
tiny things.
It could be facial expression. It could be tone of voice. It could be volume. It could be inflection. It could be how you're looking at them in the eyes. It's all these other things. So if you send the letter, you're getting 7% effectiveness. Now, Naren, in anything that we do, if we get 7% effectiveness, are we going to do it? No,
absolutely not. It's a waste of time.
I got to figure out how to get a lot more pop than that. So if all you do is send the letter, you're getting a 7% effectiveness. So when we're talking to people face to face, they're less likely, they're more likely to engage with you, and they're more likely to be empathetic and understanding, which is what we want to occur. But be ready for that question. Why you're dropping my dental insurance? Your team members should all be trained on that question, because we want to have a consistent answer. One thing I don't want to have is I don't want a dentalist sitting saying, I don't know, I just work in the back. I don't know anything about that.
Yes. Because what that shows is, it shows that maybe your team is not totally sold on this. Maybe they're not behind it. It shows that hesitancy. It shows that, maybe they're making a mistake.
Yeah.
So it's that subtle message of, like, when everyone is on the same page, everyone is bought into it, everyone is, believes in it. Even the tone of voice, like you said, makes a big difference.
I want everyone in the team, everyone. I don't care if she just started yesterday, to be able to answer the question, why are you dropping my dental insurance? Now, granted, if the question starts to get very deep and very technical, there's nothing wrong with saying, Naren, I'm so glad you're asking these questions. Let me go grab Susan. She's our insurance expert. Let me grab Susan because I really want you to hear it from her. She's an authority on this. And then we get Susan, and Susan, jumps in to provide more depth. But everyone on the team should be able to answer the question, why are you dropping my dental insurance? And there's another way. Again, remember, the D's and the I's don't need much information. If we go back to the DISC, the DISC personality style, the D's and the I's don't need a lot of information. They don't need, like, for example, if they're missing a second molar, I'll use a clinical example. If a D or I is missing a second molar, and you want to talk to them about having a dental implant, all they want to know, by virtue of their subconscious personality, all they want to know is, how soon can you get started? How long is it going to take? And how much does it cost? That's what they want to know about the implant. They don't want to know what the S's and C's. The S's and C's want all the details. The S's and C's want to know, how does the titanium screw osseointegrate into the mandible? And what do you use as tooth material to cover the screw? And do you have 20-year studies on the tooth material? And are there choices? Are there other tooth material choices that we could use? And what's the biocompatibility of that tooth material? Now, those are fair questions from S's and C's, but you're not going to get those from the D's and the I's. So how might I answer if you know the patient's a D or I? Why are you dropping my dental insurance? To ensure that we can always take care of you by delivering the highest quality care and making sure that every visit is a comfortable experience for you. That was the short version of what I led off with. But notice what I just did, Naren? I answered the question to a D or I because they don't need chapter and verse. Naren, the reason why we're doing this is to always ensure that we can deliver the highest quality dentistry and make every visit a positive experience for you.